My name is Jessica Schechtman, and I'm an OBGYN physician with CHRISTUS Women's Health. So I'm originally from Norwalk, Ohio, which is kind of middle of nowhere, rural Ohio. Nice small community, very family-oriented type of area. I'd have to say probably my family had the biggest influence on my life. My father was in the Navy and got out, and he worked at a Ford plant on the assembly line, and my mother did medical coding and billing in a chiropractor's office. Growing up, education was the biggest thing for us to focus on. School was our #1 thing growing up, and that was a big value in our household. So continuing on education and going forward was a huge role. I chose to go into medicine, the stereotypical, like everyone likes to help people. I initially went to medical school thinking I was going to be an emergency room physician. I actually worked EMS for the first 5 years out of getting out of high school through college as well as into my first year of medical school. But I realized in medical school that I really enjoyed more working with patients and getting to develop relationships with them. So then I chose to go to OBGYN to come across an entire lifespan of a woman from giving birth to all the way up through menopause. The thing I love the most about OBGYN is probably being in the operating room. I thoroughly enjoy working with my hands and actually being able to physically fix something and then see the outcome in the recovery afterwards. I'm actually a doctor of osteopathic medicine, or a DO, as opposed to an MD. It's a holistic approach to medicine and being very patient-centered. So my philosophy and my coming to patients is more of a patient-centered approach where we come along together, we make a joint plan of care, and then continue forward.